Hands and Hearts. Welcome to our webinar, Connecting Hands and Hearts, Behavioral Health Partnerships for Children and Adolescents During the Pandemic. I am Andrea McGlynn, the Health Policy and Program Associate at the Institute for Medicaid Innovation. Before we get started, I want to review a few details for today's session. This webinar will be recorded and archived with all accompanying materials on the IMI website within 1 week of this session. Please note that the information presented today on October 21st, 2022 may change over time. Anyone watching this as an archived recording should check updated resources and links. Today's session will include an introduction and overview, panel discussion, and a Q&A session for you to ask questions of our panelists. To ask a question, please use the Q&A feature on Zoom at any point during the session. In the event that we receive more questions than we can answer within today's webinar, we will provide all questions to today's panelists for a written response. We will post their responses to frequently asked questions with the webinar materials. At the conclusion of the webinar, we will put in the chat box a link to complete a short 3-minute feedback survey. Please give your feedback. We encourage everyone to live tweet today's session. Follow IMI on Twitter. Our Twitter handle is at the bottom right-hand corner of the slide. Now let's get started. I'm excited to introduce our session moderators, Dr. Sandra Hassink and Ann Gazzoni. Ann Gazzoni is the co-chair of the IMI Behavioral Health Subcommittee and a member of the IMI National Advisory Board. She is a licensed clinical social worker and a senior program manager for behavioral health integration at UPMC Health Plan. Dr. Hassink is the chair of the IMI Child and Adolescent Health Subcommittee and a member of the IMI National Advisory Board. She's the past president of the American Academy of Pediatrics and the medical director of the American Academy of Pediatrics Institute for Healthy Childhood Weight. Thank you, Ann Gazzoni and Dr. Hassink, for moderating this webinar. Dr. Hassink, you're on mute.
I am so sorry. And thank you, Andrea, for the introduction. And I look forward to spending this hour with everyone as we highlight 2 programs that emerged amidst the COVID-19 pandemic to support child and adolescent mental health. During our time together this afternoon, we hope to achieve the learning objectives you see on your screen. I'm going to provide a brief background on IMI and the topic of our webinar, and then my co-moderator, Ann Gazzoni, will introduce our panelists. The Institute for Medicaid Innovation is a national 501c3 nonprofit, nonpartisan research and policy organization located in Washington, D.C. We are charged with leading scientific and policy initiatives that produce objective resources while supporting implementation efforts to scale up promising best practices and innovative initiatives. As noted on this slide, the mission of IMI is to improve the lives of Medicaid enrollees through the development, implementation, and dissemination of innovative and evidence-based models of care that promote quality, value, equity, and the engagement of individuals, families, and communities. This webinar is brought to you by a collaboration between 2 of IMI's subcommittees, the Child and Adolescent Health and Committee and the Behavioral Health Committee. We invite you to learn more about all of IMI's committees on our website. And this is the second of our 2022 webinar series. Today's webinar is focused on IMI's community and equity strategic priority. Feel free to use the link we placed in the chat to view webinar 1. We planned this second webinar for the time of year when people and communities come together to support children and adolescents as they face the rising academic demands and other stressors that set in a month or 2 into the school year. And I think we're all aware that in the past few years, a crisis has emerged in child and adolescent mental health for families at the individual level and across our nation. The prevalence of depression and anxiety were steadily increasing prior to the COVID-19 pandemic, but concerns increased dramatically when the pandemic caused school closures for in-person learning, suspended outpatient healthcare, and decreased support services of all types, including enrichment activities, transportation, social services, and more. These changes and decreased use of behavioral healthcare by children and adolescents were soon evident. And in October of 2021, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association jointly declared a national emergency in child and adolescent mental health. CDC data that reported 44% of children were experiencing persistent feelings of sadness or hopelessness, and this was staggering, but not necessarily surprising to those in direct contact with youth who have felt unprecedented concern for children's and adolescents' emotional well-being. Yet bright spots were emerging in the communities where partners came together quickly during the pandemic to innovate solutions. For pediatric healthcare, education, and the entire public service sector, finding these bright spots became an urgent need. The Department of Health and Human Services launched a listening tour, and just last month released a roadmap and an array of mental health grants with a primary focus on school-based programs. As many of you are likely considering these opportunities, it is critical to identify how to scale solutions for youth covered by Medicaid. Medicaid and CHIP are critical levers as they currently provide healthcare coverage for half the nation's children. In June of this year, IMI released a compendium profiling Medicaid's health plans, innovative initiatives, partnering with communities during the pandemic to develop a wide range of interventions, including new approaches to behavioral health access. And we are pleased to feature two of these community-based programs today. These programs were launched with support of Medicaid health plans in the height of the public health emergency, and the community organizations further developed their programs to serve this mental health wave of the pandemic. My co-moderator, Ann Gazzoni, will introduce our panel of frontline collaborators to share the bright spots they've created. And we hope their innovation and commitment to connecting hands and hearts at the community level will kindle sparks of both ideas and inspiration for all of you.
Thank you for sharing that important data, Dr. Hasek. I will now introduce our panelists, their organizations, and the health plans that they partnered with. First, I'd like to provide an overview of HealthNet's telehealth capacity grant program in California. HealthNet's goal was to establish and expand telehealth services for enrollees in California's Medicaid program, Medi-Cal. In doing so, they provided 138 telehealth capacity grants to clinical provider groups across the state, of which almost 20% had no existing telehealth technology at the start of the pandemic. Camarena Health, a federally qualified health center with locations in Central Valley of California, was one of the multiple grantees that reported success in providing mental health services as a result of the grant. Today, we are privileged to have Rosalba Serrano, the Director of Behavioral Health of Camarena Health. We have placed a link in the chat to view full bios for Rosalba and each of the panelists. Now I turn it over to Rosalba to introduce her colleague and co-panelists and share information about their pandemic pivots to address the need of their community. Rosalba?
Thank you, Anne. I wanted to also introduce Jonathan Del Toro. Jonathan, what's nice is that he was proud to serve in the community that he grew up in, Madera. He has been a behavioral health navigator since 2021, although he was with Camarena Health before that. And so together we're going to discuss a little on Camarena Health and the telehealth program. Next slide, please. So just information about Camarena Health. As Anne had mentioned, we are a federally qualified health center located in Madera, California. And if you're familiar with California, that we're right in the middle of it. So we are in the Central Valley. We have 19 health centers throughout Madera, Chowchilla, Coarse Gold, Oakers, and Fresno. And that is, we serve a lot of rural communities, small communities We have different services at Camarena Health. We provide family medicine, pediatrics, women's health, optometry, chiro, behavioral health, telepsychiatry. A snapshot of our population is that 67% of our population is Latino. 42% of our population is agricultural. We have a large migrant population, and over 70% of our population is either Medi-Cal, Medicare, or uninsured. Last year, in 2021, we had about 278,000 encounters, and out of those 278,000 encounters, about 16,000 were behavioral health encounters. So we're pretty busy last year. Our team consists of 10 behavioral health clinicians who are bilingual and bicultural. They consist of licensed clinical social workers, licensed marriage family therapists, associate clinical social workers, and associate marriage and family therapist. We have 3 behavioral health community navigators, again, who are all bilingual and bicultural. We have 1 behavioral health case manager, and we also expanded on our telepsychiatry providers. Our telehealth program, with the moving on to the Health Net Capacity Grant, we launched a telehealth program when COVID was happening. And so at this time, we implemented what we call DoxyMe, and this is interactive telehealth communication system. And what's nice about this system is that it's easily accessible through patient's mobile device. We didn't need to download an application. And what we ended up reporting with the telehealth program is that our no-shows decreased for behavioral health, which meant that before COVID, it was about 25% no-show rate. And when we implemented the telehealth program, we had about 18%. And that has been pretty consistent throughout since the telehealth program. And we kept track of these reports, and that was important to us. And overall, what we know is that the visits as patients, they reported a positive experience in accessing behavioral health services via telehealth delivery. Some of the challenges that came about was, again, having access to adequate internet connection. We do have what we call a mountain community, and so sometimes having that internet connection can be difficult. Having access to smartphone equipment for the platform, and then unstable internet connection. Again, this was mainly for our mountain community. And so if we couldn't access the video component, the video platform, we ended up doing the telephone. And so that was nice that we were able, through this challenge, we were able to navigate with telephone. Some of the benefits were, it was nice that we had options for our younger patients with the video. And so during COVID, again, we went about 65% over to telehealth. And so we kept in mind, and we're mindful of our smaller children, again, being engaged in this behavioral health, mental health visits. So we had to get very creative. So we thought of scavenger hunts, so where we would tell maybe a younger child saying, let's go find, a book that's really meaningful to you and bring it back and show it to me. Or let's go bring a ball and let's practice, squishing it. We did a lot of puppetry, or read books. And so that was nice that we're able to get creative and engage these younger patients. And not only the patients, but also their parents were engaged. They were right there next to them. And so being able to build these meaningful connections, again, there is an engagement. It's a very easy to use application. Again, the DoxyMe, we send a link over. And we would send the instructions beforehand as well. So they had these instructions, and so they would log on and they would accept it. And so very easy to use. And then the development of strategic use of hybrid options, which is happening now. And so now a lot of patients are back in clinic. And so we'd use a hybrid option. And so if somebody, for example, is having difficulty coming into the clinic because perhaps they don't have transportation, is that it's nice that we have the hybrid option, that we continue to use either video or telephone option if they chose to, or come in. And so sometimes, depending on the session and what's happening, then again, we encourage patients to come in and see us so we can have build that rapport. It's been really beneficial to us overall, the telehealth program and what it's brought to Camarena. Next slide, please. So a brief overview of our program overview is that we built this partnership with our Madera County school districts. Not only our school districts, again, the whole entire school district in Madera County. We have 2 school-based clinics where the students can receive behavioral health offices. And we purposely set these school-based health centers at our high schools. And so it's navigated through the nurses station. We have 3 navigators, Jonathan being one today, and we have 2 other navigators who are assigned to various schools and within Madera County, who go out and meet the students, the teachers, and are able to collaborate with our schools. As the students receiving services they can range from kindergarten, 5 years old, all the way to 12th grade seniors. Jonathan.
And the goals of the program. So the goals of the programs are to increase access to behavioral health services for students. And this also applies to our rural communities where behavioral health services can sometimes be hard to access or come across. We also provide case management services to students and families with multiple needs. And we also identify gaps in services and facilitate linkages and access between schools and Camarena to meet specific needs. And so how does the BH program work? So the Behavioral Health Community Care Navigator program, the way it works is our goal is to make it simple. So we made a simple process for referring the referring party to submit a referral on the Camarena website. Then the students have the option of either receiving services in person or via telehealth. And like Rosalba mentioned, that could either be telephonic or through our video chat service DocSeeMe. And then students can also receive services directly from our school-based clinics. And then lastly, we facilitate direct access to a behavioral health community navigator who will provide case management and quick linkage to a counselor. Thank you.
Thank you, Jonathan. Thank you, Rosalba. It was wonderful to hear what you have developed in such a short period of time, and telehealth is so important in behavioral health right now. I look forward to learning more through our Q&A. The second partnership highlighted in today's webinar is between Highmark Whole Care Health Plan and the 1889 Jefferson Center for Population Health in Cambria and Somerset counties in Pennsylvania. Using the community care hub model for maternity home visits, their program sought to improve maternal health outcomes and reduce disparities by offering the program to birthing persons in the area. This program funded a network of care coordination agencies that hired and trained community health workers who met individuals in their homes. It was through this model that the behavioral health initiative we are discussing today was born. Today, we are so pleased to have Janine McMillan, the Executive Director of the 1889 Jefferson Center for Population Health, which serves Cambria and Somerset counties in Western Pennsylvania. I will now turn it over to Janine to introduce her colleagues and co-panelists. And again, please visit their full bios at the link in the chat box. Janine?
Thanks, Anne. Hi, everyone. My name is Janine McMillan. I am the Executive Director of the 1889 Jefferson Center for Population Health. I've 2 of my colleagues here with us today, Ms. Shaylee Wallace, who is a certified community health worker with Community Action Partnership of Cambria County, and Mr. Don Trotz, who is a guidance counselor at the Greater Johnstown School District. Next slide. A little bit of a background on who we are. The 1889 Jefferson Center for Population Health was founded as a collaborative research and resource center focused on population and public health initiatives in Cambria and Somerset counties in Pennsylvania. We are primarily a rural community in the beautiful Allegheny Mountains, about 70 miles east of Pittsburgh. Our Community Care Hub initiative is an initiative of the 1889 Jefferson Center for Population Health and serves at-risk residents in our 2-county region. So a little bit about what a hub is. A hub is an organized, outcome-focused network of care coordination agencies that hire and train community health workers and connect at-risk individuals to desperately needed services. We launched the hub in September of 2020, and I usually tell folks that while it's not ideal to launch a home-based visiting program, in the middle of a global pandemic, what it really showed us was that those connections that the community health workers have been able to make for these individuals were really so desperately needed from folks who were feeling very isolated and needed to be able to continue to connect to those services. We follow the Pathways Community Hub Institute model, which is a national model that provides an evidence-based framework for care coordination for those individuals, again, who are most at risk in our communities. Our hub is currently comprised of 3 care coordination agencies, and these are existing agencies who are established in the community, and 6 community health workers. Our partner agencies are Alleghenies United Cerebral Palsy, Beginnings Incorporated, and Community Action Partnership of Cambria County, who Shaylee is employed with. We've experienced some pretty significant growth over the past 2 years, as you can imagine, and we do have plans to expand our care coordination agency network and add additional community health workers as well. So the community health workers meet with participants face-to-face, preferably in their homes, and then guide them through 1 or more of 21 pathways that are really designed to address their needs. These pathways include connections to medical services, including connections to behavioral health providers, social services, food, transportation, housing, and much more. But the CHWs are not just providing a phone number to individuals, but they are truly working hand in hand with their participants and ensuring that the needs are met and the pathways criteria completion is met before closing out that pathway. Payers and funders contract with the hub to support the work that the community health workers are doing and pay for the completion of the pathways for the hub participants. As I mentioned, the hub launched in September of 2020, initially serving at-risk pregnant women, and has expanded to now serve school district families and those with a diabetes diagnosis, which is a very new launch for us. So we're very excited about that. Next slide, please. Our second pivot then to working with the school district population has been very successful. The team members for that initiative include school guidance counselors, including Mr. Don Trotz. And we apologize for some of the technical difficulties. The sun just decided to shine in a different spot, but I promise you Don is there. Our community health workers, again, we have 6 community health workers who are part of our network, including Ms. Shaylee Wallace. And our hub staff and the many, many health and human service agencies in the region that the community health workers connect individuals to and establish those partnerships and referral partnerships and relationships. The goal for the school district partnership is truly to increase not only the connections to health and human service agencies for our families to improve their situations, but also provide support needed for the students to help ultimately improve their grades and decrease absenteeism. We know that by addressing those social determinant of health issues and ensuring that they're addressed on the home front will make it easier for those students to be able to improve their attendance and improve their academic performance. Our school guidance counselor identifies families who could benefit from the connection to a community health worker and makes that referral to the hub. Since May of 2021, I'm excited to share that there have been 150 families referred to the hub, with 107 families agreeing to enrollment and have worked with the hub since then. So again, very successful, and we're so excited about this partnership. We're also currently working on a full data analysis of the outcomes from the school district, or the school year last year for those referrals, for those participants that were involved in the hub, and we're excited to share that with our community partners and collaborators. Thank you.
Thank you. Thank you, Rosalba, Jonathan, Janine, Don, and Shaylee. And before we delve into questions about your work, we did want to recognize how important it is that your teams connected the hands and hearts with educators, acknowledging that for many, the school setting is a comforting, safe place and can be a sanctuary when there is chaos and strife in the home and community. Both our panelists and committee members who organized this webinar draw on rich professional and lived experiences that inform this work. Thank goodness for the teachers, social workers, counselors, navigators, and others that in myriad ways provide an environment of caring stability to counter both the ups and down stresses of childhood and adolescence, and for some, the traumas of adverse childhood experiences. Now we're all eager to ask questions of our full panel. And as we begin, I would like to remind all the webinar participants to enter your questions into the Q&A at any point. Anne?
Thank you. To Janine and Rosalba, your programs are very exciting to me as a behavioral health clinician, knowing that across the country there are behavioral health work shortages. We need to partner to provide other resources. Janine and Rosalba, what spurred the idea to create these partnerships to address this important need? Janine, would you like to go first?
Sure. So because our hub had launched in September of 2020, we had already established this resource in the community with that maternal population. We had conversations with the administrative team at the school district who were sharing those stories of such great need with the students, particularly, again, navigating that isolating world that the pandemic brought for us. And so, I think, recognizing that we had this program established, we knew that the way that the Pathways model is structured, that we could really apply that structure to any population, any at-risk population in the community. And it really just felt like such a great opportunity to be able to expand and work with these families that were, again, really truly at risk and could benefit from that connection to a community health worker.
That's great. Thank you. Rosalba?
Yes. So our partnership came about before COVID. There is an increase in 5150s where students were being sent over to our local hospitals to get further evaluated. And it was very traumatizing to be able, again, that further evaluation, what that meant, that threat assessment team would go in and evaluate the student, and then if needed, again, be transported by ambulance. So it could be very traumatizing. So we thought, again, how could we decrease this 5150s and what's happening? And so we came up again with, if we located, again, these therapists in schools, the navigators working with our schools, if that would help. And so it's a very neat concept, the school-based health centers, where the students report is, for example, if somebody is struggling with anxiety or depression or stress that day, they talk to their teacher sends them over to the nurses. The nurses station is connected with their health center, so nobody sees. It's all confidential, and because it's a health center, nobody knows what they're there for. So our health center, again, they can be seen by their medical provider. They can be seen there for dental, their health educator, their registered dietitian. So nobody knows. Again, we have two entrances, through the nurse's station and through our community, what we call it. When the therapist is ready to bring in the student, we bring them into the nurses, straight to our room, have our session, and take them out through the nurse's station where they get a note to go back to class. Very neat concept. Again, their parents, if they're working, again, we have a lot of migrant family workers here who are not able to take their students. And so we're able to, again, these students were able to see a decrease in those attendance rates as well.
Yeah, both sound like a great model. Thank you so very much. Now turning to Dawn and Jonathan, from your perspectives, what about kids with behavioral health needs, and has it changed since the pandemic? How does your program help you work differently than before to address those needs? Jonathan?
Yeah, so since the pandemic, we've seen an increase of students who, are struggling with depression or anxiety symptoms. And then we also see an increase of students who, are struggling with social skills, how to interact with others. So that's kind of been the biggest impact that we've seen. And our program has helped us work differently in the sense that we can now offer telehealth services, whether it's telephonic or through video. And, that helps a lot, especially now, we also see that sometimes finances could be a barrier, whether it's, not having like transportation to, go to the appointment, or we even see the increase in gas, some people sometimes struggle with that issue. And then, like Rosalba had mentioned earlier, we serve a lot of the rural communities and the mountain communities as well. And sometimes people just don't have that transportation to come down into town and receive the behavioral health services. So I think that's been something that has helped us a lot in progressing the work that we do, is by offering telehealth and video appointments to our patients and students.
Great, thank you. How about you, Dawn? What kinds of changes have you seen?
I'd say, Anne, thank you for asking that question. Isolation and fear during the pandemic, unbelievable isolation, unbelievable fear. These students, even very difficult to now leave their homes to come back into the school setting because they felt that safe haven, at home. So what we had to do is transition through the community hub, and we were able to get community care hub workers, or health workers, as we say, to be able to reach out to these families, to reach out to these children in this time of need, not only with the isolation and fear, but these people didn't know how to live again. It was almost like their life had paused and they were just in existence. So it's almost like we had to retrain people how to live and feel safe again. And thank God we were able to get these community care hub workers to go in homes, which allowed people now to come to school, attendance, which has improved. Also academically, of course, when you're out of school so long and it's up and down, everybody's falling behind. And we were able to project, see increases in both academic attendance. And we deal constantly, not only with the students, but even their parents, even teachers in the educational world, trying to get people to relive again. And it's just been just an awesome collaboration where everybody, the agencies in this county, the people, all coming together for one cause is phenomenal.
That's great, Dawn. And it sounds like, both of you have some really great interventions to help kids. And I really appreciate those insights. Shaylee and Rosalba, I'm always interested in how various members of an interdisciplinary team use assessments. What assessments or screens do you find most helpful with your respective roles? And I'll start with Shaylee as a community health worker. Shaylee?
Good morning. Well, I guess afternoon. A lot of the people that I get referred to me are already screened, if I'm thinking that you're meaning that the same way. But what I do is let's say if Dawn has referred somebody to me, I go in and I meet the family. And I do a lot of motivational interviewing, and that's a really good way to gain trust. Fear is something Dawn said. I see a lot of fear. And when the children that he refers to me, when they are having barriers or they're at risk, there's usually a root problem. And so what I do is I try to get into the home. If I can't get into the home yet, I use Zoom a lot. I'm kind of the Zoom queen. And then I start to build a relationship with the family, the parents. Then usually I can get into the home and start visiting with them. And I kind of just root out the problem. And a lot of it is fear. They're afraid to go out. They're afraid to deal with people. They're afraid to tell the truth. They're afraid to admit what they need because they're afraid to lose their kids, their money, their benefits, anything. And so what I'm trying to do is just to show them that they don't have to be afraid if they need help, because we all need help. My CEO taught me something very, very important a long time ago. He says that you're usually only one decision away from being on the other side of the desk. And I've been on the other side of the desk. And so it's important to me to help people.
Great, thank you so much. And from the perspective of behavioral health clinician, Rosalba, what are your thoughts?
Yes. So pre-COVID, we did start to implement adverse childhood experiences. So ACEs, as some of you may know them. And so we started, it was important for me, so not only our behavioral health team, but our medical providers to be trained in ACEs and what that meant when we see our patients and trauma informed and what is a score, right? And so a score doesn't define us. And so that was very important. And so we did. So after COVID, again, we've all taken the adverse childhood experiences training through ACEs Aware, and we actually started to implement ACEs. And so now implementing ACEs, when we see our patients, even this includes our medical providers and our behavioral health providers, has been very nice, especially at our school-based health centers, and training our teachers, our school staff, and our medical setting. So that when we say training, it means all our entire staff, our front support, our back support, our medical providers on what that means, what is trauma informed. And again, and so I think that's been very important in our school districts for students who perhaps are struggling with some behavioral issues on what's happening, what's happened. And so we've, again, ACEs is something that we've implemented.
Thank you. Thank you, all of you. And as a pediatrician, I'm so excited to hear about this, the team that you're bringing to the home, to the school, to help the students and their families and the kids and adolescents. I'd like to ask Janine and Rosalba, how can these programs, the programs like yours, best maximize the Medicaid program and the roles of Medicaid health plans? And Janine, how do you see that happening?
Yes, I think for us, we were very fortunate with our partnership with Highmark Whole Care. I can't say enough good things about, their foresight and willingness to collaborate to help to meet the needs of their maternal population. We were able to help to support our existing community health worker program with that support. But we do serve many individuals who have other payers as their providers. So for the school district population, for example, while we do not currently have any payer funding that supports that population, there's definitely, I think, an opportunity from an MCO perspective to recognize this is definitely a huge need area. We are so fortunate. We have a partnership with a local philanthropic organization, the 1889 Foundation, that provides the funding to help offset, the funding shortfalls that we have from that standpoint. So, I think those types of partnerships with the MCOs will help other communities like ours to be able to expand and meet the needs of more vulnerable populations, including those school district families as well. So,
thank you, Janine. And Rosalba, how would you see this?
Sorry, being a federally qualified health centers, I feel like we do a very great job at working with our health plans, including HealthNet, and enrolling our patients in different health plans and who cover not only the physical component, but also the mental health component, so that are able to cover, again, the behavioral health, and that we have insurance specialists, again, who are in our clinics. So for those patients, again, who are not yet enrolled, could help them enroll in an insurance plan. We have grants who also help serve the needs to our students with, for example, these grants cover the behavioral health services, so necessarily they don't have to enroll in a health plan. But I think that we do a great plan working really closely with our health plans and enrolling these patients.
Thank you so much. And now we're going to do a little bit of a lightning round with the whole panel. And I'm going to ask you each to give us your inspiration. What inspiration would you give all of us and all of us listening to the panel about your work? And we're going to start with Pennsylvania and move to California. So Shaylee, give us your inspiration here.
My inspiration is just to bring the community together, especially after the pandemic, just to make sure people know that they have connections to other people, so you're not alone. I'm here to just kind of guide people to stop being so scared to reach out for help.
And thank you for being there, Shaylee. And
Thank
Don.
The inspiration that I always see is the before and the after effect. Being in a school system, I know the situations, I visit the homes, I meet with the parents, I see the children, and to see them being helped and connected with all these resources that are abundant in our community through this program. And then you see the after effect. You see them just a whole different character, the fear going, the desire to want to be to school. They can't wait to come to school. Academic levels going up. That's an inspiration to just keep moving forward every single day.
And Don, I couldn't agree with you more. It's like seeing the children light up. So wonderful. And how about you, Janine? Where do you get your inspiration?
I don't know, probably a little bit of inspiration and a little bit of advice to maybe some other folks on the call. Our motto truly is collaboration from a center perspective as well as the hub perspective. We have so many amazing, as Dawn said, amazing agencies and healthcare providers, social service agencies, all working in the community. But we all know that we can't be everything to everyone, any of these agencies, and that the only way that we're going to be able to address the needs of these individuals, really looking at it from that whole person care perspective, is if we all collaborate together. So we've seen such a transformation over the past few years in our community, really with providers working toward a more collaborative approach to try to address these needs. So it's been inspirational to see that for sure.
Yeah, and I do think there's joy and inspiration, Janine, in collaboration. I do think we all feel that. And moving to California, Rosalba, tell us a little bit about your inspiration.
I agree with you both. Again, for us, it's been also the collaboration in the community. So not only our school districts, also our local behavioral health, our health plans, our public health. And so everybody in the community itself, it was really nice. We end up having these collaborative meetings with really having the community in mind. What's really inspirational is, again, being able to provide mental health access to not only our students, but patients in our rural areas that before COVID, it was really hard because of barriers, whether it be transportation, finances, and that with the telehealth, we're able to do that, to remove some of those barriers and to be able to provide mental health access to our families and people in need.
Yeah, so important and really so satisfying in a way to do that. Yeah. And Jonathan, where do you find your inspiration?
Yeah, so my inspiration just comes from working with the students and just seeing that progress. We all know how detrimental, sometimes these mental health issues could be, that these students struggle with. And just, from when you start seeing them, and then from, when you've been seeing them for like a few months already, and then to have a student come back and tell you, something like, oh, I finally mustered up the courage to try out for the sport, or, I did my presentation and it went, wow, something that in the very beginning they might have been scared to do, or they just had too much anxiety or too much stress going on. And so I always approach every student with this idea to help them live their life to the fullest, because when we're not living our life to the fullest, it really does hold us back from achieving and accomplishing a lot of things.
Oh, thank you so much. And I love that, living our life to the fullest. And I think, Don, you said it well, we're coming out of this fear-based status from COVID. I wanted to ask, and we'll start with you, Don, many of our children, adolescents, and adults also suffer from stigma about accessing mental health and behavioral health services, stigma about just labeling that might occur. And how do you address that, or how do you help them with that?
I reach out, and even when we refer the community hub through the Jefferson Population for Health, when we go for a referral process, I reach out to the parent. If I don't get them, I go to the home, I converse with them. I want them to be able to trust, and I think that's a huge word. I want them to be able to trust in what's about to happen, trust the people that are going to lead them and get them through the process, and trust us enough to open up, be transparent with us. And that has been my goal, and I'll continue, that'll continue to be the forefront of every person that I refer for the mental health services, for access, because a lot of folks will, there's the denial fact. They'll try to hide from serious situations or mental health situations. And I really try to go in there with a trust factor, and build a relationship. That's so important. You build a relationship with someone, and all of a sudden trust begins to build, and the access and the available connection and resources all begin to flow. And it's a beautiful process. Takes time, but it's a beautiful process.
Shaylee, I know you probably deal with this as well. How do you sort of, there's some fear, right? There's stigma, fear of the stigma, but also fear that what if, the family comes under scrutiny, and, how do you deal with that?
Well, I mean, the best thing that I know how to do is, number one, I try to reword things, and I'm not necessarily a person that likes to make everything word friendly, because, things are what they are, and I don't like to blush anything over. But when it comes to mental health services, I try to make sure that it doesn't, because when you say that, fear right there, scared. So I try to evaluate who the person is who I'm talking to, and just kind of reword that. And I let them know what the process is, and it's not a scary thing. Just like your liver, your brain needs to be taken care of. And we all have emotions. A lot of my clients saying this are pregnant, and so it's a lot easier to have that conversation with them, because I tell them, when you're going through a change like this, stress, hormones, everything, your brain chemistry changes, and we sometimes need a little help in that area, and nobody's immune. And so that usually will open up at least a little bit of a communication. I did have one person flat out shut me down, told me never to bring it up again. She called me 48 hours later on a Sunday afternoon and said, yeah, I think I'd like to do that. Yeah. So that was my best moment with that one. It was like, yeah. But that's the best thing you can do, is just explain it to them to take away the guessing. And of course I explain HIPAA, and everything is private. Nobody's going to know, unless they tell somebody, and I kind of go from there.
So you open the door, and with open arms. And I know, yeah. And I know, Rosalba, you spent some time talking about the physical situation for your students, which I think is very important. So I'm going to ask Jonathan, how do you help your students in terms of the stigma sometimes that they may feel?
Yeah, well, it's pretty neat, because we have 2 school-based clinics. So even if there is that stigma, we're able to just accommodate them in that way, where if, for example, if they have an appointment with one of the counselors, the school will just call them and send them to the nurse's office, just to avoid that stigma, or students questioning them like, hey, where are you going? And then also to, just reminding them, that, this is, it's normal nowadays, for people to, seek, how for, behavioral health services, just remind them, that, we're here to like break the stigma. And another thing that we do as well is during May and October, which is Mental Health Awareness Month and then Suicide Awareness Month, we always go out to all the high schools and all the schools here within Madera and Madera County. And, we do tablings, we provide the students with resources, and, kind of just to normalize it. And again, break the stigma. And it's pretty neat too, because sometimes you have those outspoken students that come up to your table and they'll tell you like, oh, I see a counselor, or I see a counselor at your clinic, and they're with their group of friends, and so like, I feel like it's already kind of working in the sense that it's becoming more of a normal thing for students. And they don't shy away from sharing it with, their peers as well, that they receive help. And I think that's a great thing as well, because we always encourage students too, like, hey, if you ever have a friend in need, let them know what's out there, remind them that there's school staff, there's counselors at the schools, and then we also tell them, you got 2 school-based clinics, with counselors, you got case managers. So just always going with that approach of breaking the stigma.
Yeah, and I think normalizing it and helping them feel comfortable. And somebody once told me, if you don't think that the kids are out there talking about mental health, they are talking about mental health. They're talking among themselves. They're talking with their peers. So normalizing it is important. So thank you all for just for the approach and the kind and compassionate approach that you have with your students and adolescents.
Yes, thank you all. It's such a wonderful overview of your programs. And now we'd like to go into some audience questions, go into some Q&A questions. So please continue to submit your questions through the Q&A in the Zoom, and we can review those. So Rosalba, one of our participants, they're interested in knowing more about the ethnic racial breakout of your students and patients, and the percentage of Native, Black, maybe Asian population that you might serve. But more importantly, how to provide culturally congruent services. I also know you have you mentioned a large migrant population. How does that affect the services you provide?
Yes, so I don't have that breakdown in front of me, so I apologize. I can for sure send it over. We do have, again, a large population of migrant Latino community here in Madera. And so it's very important for us when we do the hiring that we try to be mindful in who we hire. And again, the bilingual, bicultural piece of it. And so people are very comfortable, again, if they wanted to have a session. And for example, if parent was only monolingual in Spanish, then that we're able to provide those services to our families in the language they speak. And so, and again, our clinicians will take culturally sensitive classes and trainings because it is important to be able to be culturally sensitive to the different cultures and diversity that we have here in the county as well.
That's great. That's great. Another question that I was thinking of was with your telehealth that you have. I know when I was providing behavioral health, childcare was always an issue if people had small children. And I wondered if you think that, you mentioned the increase of your show rate with the telehealth, how, childcare might have an aspect of that, because then they don't have to bring all the little ones with them and all of that, or find someone to watch them. How do you think that comes into it?
Right. And so that was really nice about it. And so we do ask, again, just that it's a confidential area, that it's a safe area. So we do assess for that. And so, for example, if we, because it happened, we would have our appointments and we would call the patient, and sometimes they were at their local grocery store shopping, and we thought, oh, it's okay, we can reschedule. And so having that flexibility, again, that it's life. We have to go grocery shopping, and so maybe they forgot their appointment. And again, just being able to reschedule those patients, it worked really nice though, because if, for example, they had a little one and they knew around what time their little one took a nap, then we did it. Or I have to tell you, or lunchtime. Sometimes they're like, I'm at work. I don't have the flexibility at work to be able to go to my appointment, leave for an hour or two and then come back. Then we knew at 12 o'clock, 1 o'clock that we would call them. And so that's what's been really nice, again, with our team, that there's so much flexibility. We come in at different times and we have staff who works a little bit later, just to be able to be flexible with our community and our patients.
Yeah, that's great. Thank you so much.
Oh, one last question. I'd like to ask how you all work with other healthcare providers in arranging and care coordinating your services. Other social workers, pediatricians, dietitians. How do you work with them? And any one of you can start this up.
I can start just because we're at a federally qualified health center. And so perhaps it's a little easier on our end because we have, again, so we provide different services, and we do have a registered dietitian, and again, our medical providers and our chiro. What's neat about the program is that, or here at the clinic, is that, for example, if we had a patient who was struggling perhaps with an eating disorder is that we have a registered dietitian where we could refer this patient over to the registered dietitian, over to her medical provider. So we have the whole team efforts in being able to help this patient. So we truly say it's a one stop, that it's really providing the whole person care, being able to work really closely with our medical providers. For example, if somebody's out of a refill on their medication, or if somebody was interested in medication, then we have telepsychiatry. And so in that area, I feel, again, really lucky that we have all these different services in one facility that we can easily access.
Thank you. And Janine, do you want to tell us how you work around your other providers in your community?
Yeah, so we have some really fantastic relationships with the medical providers in the community, not only from a referral standpoint, we particularly for our maternal population, we have direct referrals that come from the nurses who are doing the initial assessment of the newly pregnant women. So they're sending those referrals over. Our goal is to have those referrals sent as early in their pregnancy as possible so that we can work with them, as long as we can during their pregnancy to ensure those healthy birth outcomes. But we also work very closely with our local diabetes institute for our diabetic population. And, really, again, it goes back to that word collaboration. We know that we need to not only, address the social and human service needs of the individuals, but those medical needs as well. With the pathways model, there are many pathways that address medical needs. There's a medical home pathway, an oral health pathway, a mental health pathway. So the community health workers, when they identify that there may be needs in those areas, they open up that pathway, ensure that connection to those services is made, and make sure they get to that first appointment before they close that pathway out.
Thank you so much. And now I just wanted to thank all our panelists and for their time and their care and attention to their children, the adolescents, the families, and to helping produce this webinar with the IMI Subcommittee on Child and Adolescent Health and the Behavioral Health Committee. I just wanted to reflect just for a moment on what we heard. We heard about collaboration, about reducing fear and stigma. We learned about keeping your eye on what's happening to your children and adolescents in the community. We learned about how important outreach in non-traditional sometimes settings is, how important it also is to leverage existing structures and build out on them. So I think that we hope that this has been inspiring for the participants and giving you some sparks of things that you might like to try in your own programs and situations. And to read about the start of each of these programs and other inspiring initiatives, you may want to read IMI's compendium of Managed Care's Pandemic Pivots, and we'll place a link in the chat to that compendium. And a special thank you to our panel, again, for sharing their expertise with us. I think we're all walking away with wonderful examples of partnerships that were a result of the pandemic that shifted to meet the growing mental health needs of children and families. We placed into the chat box a link to a short 3-minute survey to provide feedback on this session. And we do look forward to reading your responses and learning about your suggestions.
If you would like more information on the Institute for Medicaid Innovation, please visit our website, follow us on Twitter, and subscribe to our newsletter. That concludes our event today. Thank you again for your participation and attending today, and I hope you have a wonderful day. Thank you.